MAPS training for MDMA-assisted therapy. They've called this, it used to be called non-directive therapy. It's also been called inner-directed therapy, where there's an understanding or assumption, really, that there is this movement towards healing that's an innate movement. It's been termed InnerHealing Intelligence inside each and every one of us. And on the physical level, we can see that in how the body knows how to mend a wound. We just provide optimal conditions, keep it clean and dry. You don't have to think about it. There's an intelligence to the way the skin cells migrate, the immune cells fend off infection, and a wound heals. And so this is often an example used in describing inner healing intelligence and how that can operate on the level of our full dimensions of ourselves, our physical, mental, emotional, and even spiritual aspects of our being. And so when we trust that and encourage and support a client or participant to trust that force, then when we direct them to their unfolding experience, they can just relax and trust that what is coming up in their experience is itself valid simply because it's what is arising to their healing process. So that's this bottom-up approach. Now, in contrast, top-down approaches are more verbal cognitive. So thinking about talk therapy, cognitive behavioral therapies that follow a certain structure or formula. In the presence of a psychedelic, it's generally not believed that those more formal top-down and directive processes are most conducive to what is possible and what is actually happening when people are under the effects of a psychedelic, but rather favoring these more bottom-up processes. And so an orientation that can do this is one that a therapist is very comfortable and very curious and adept at naming and attending to present moment experience as it's unfolding, and also being comfortable with uncertainty and not needing to direct the session in any particular way, or not needing to be responsible for directing a session towards a particular outcome, but instead themselves trusting the client's inner healing intelligence and then finding ways as a therapist to optimally support that unfolding process. And so the skill sets of a therapist really can relate back to how they've cultivated these capacities in themselves, how they've learned to track and relate to their own experience in all dimensions: physical body sensations, emotional experiences, experiences that are internal and external, and both, because as a therapist, we're not only helping clients track their experience, but we're actively tracking our own experience as the whole therapeutic process is unfolded, and staying highly attuned, curious, and really staying very process-based. So there are some therapeutic modalities that we can map into this kind of framework that really emphasize these skills of mindful awareness and attention, curiosity, supporting relating differently to experience. And those tend to be the modalities that are what are considered third wave behavioral modalities. So things like dialectical behavioral therapy, or DBT, mindfulness-based interventions, mindfulness-based psychotherapy, acceptance and commitment therapy as well. And so some of these organizing principles around these types of therapeutic modalities really do sort of map to what we're starting to see maybe uniquely supported in the context of psychedelic-assisted therapy.
This mini lecture is part of Numinus' Introduction to Psychedelics, which is a free course where we explore the world of psychedelic medicines and their potential as therapeutic tools. Check out the link in the description for more info.